Thanks for joining our webinar today. My name is Janet Reed. I'm the Director of Security Compliance Services for PBSI Technology Solutions. I see that we have a lot of attendees today, so I appreciate you joining us. I hope that I will get a chance to talk with each one of you personally and answer any questions that you have. So it's 11 o'clock, so we're going to get started. So for those of you attending for the first time, I'd like to give you a brief introduction about PBSI and who we are and what we do. PBSI has been in business since 1983, and we are a technology services provider for clients in the healthcare business industries and for nonprofit organizations. We service Ohio, Kentucky, and Indiana. We have very experienced staff where most of the employees, 75% of them, have been employed with PBSI over 10 years. We provide proactive IT security monitoring, managed services, computer hardware sales, installation and support, and we also provide security compliance services. So what's on the agenda today? We're going to talk about how to set the privacy strategy within your organization, learn about the HIPAA law requirements for privacy and security rules, discuss steps to make your practice HIPAA compliant, how your IT team will play a vital role in your cybersecurity requirements, and cost-effective tools to monitor and protect security of EPHI. So why does every healthcare organization need a privacy officer? Well, because it's a HIPAA legal requirement. It's the law. So HIPAA requires that every organization, whether you're a covered entity or a business associate, you're required to appoint a leader who's going to be the driving force behind the privacy and the security efforts for the organization. And this requires that you have a clearly defined role. It has to be a laid out document that shows what the responsibilities of the privacy officer are. It would be part of your procedure manual. So there must be accountability for limiting access to systems where a PHI is kept. You're in charge of knowing who logs in, who doesn't log in, who has access. And that also includes the security of electronically transmitted PHI. You know, only 30% of HIPAA privacy officer duties are actually related to IT. Other duties are training and auditing, managing security incidents, and overseeing the compliance of the business associates. The privacy officer is additionally in charge of the facility safety and for making sure you have a disaster recovery plan and preparation. This person is actually the security leader and you're the champion in the organization for HIPAA. You will be the point of contact for all security and privacy efforts within the practice. So you have to designate who this person is, and that needs to be part of your privacy practices that you hand out to patients. So how about the business associate? So the business associate is anybody that you're working with that has access or has potential to have access to your protected health information. So a business associate has to follow the same rules that you do as far as protecting your electronic or your PHI. The HITECH Act and the Omnibus Rule both require the business associate to comply to the same extent as the covered entity. And so that means that the business associate, just like you, have to have a risk assessment, they have to have security policies and procedures, and have to have a designated privacy officer. So I service the privacy officer for PBSI. So they're responsible for securing business associate agreements for covered entities. So you are responsible to make sure that anybody that you're working with, that you have an agreement with them that says, I'm going to hold the same accountability that you do for protecting the PHI. Now, when we work with a new customer, we always supply a business associate agreement to that new customer. And many of your business associates will be IT providers, but having a privacy officer is vital for implementing your IT security. So there's both a practical side to why the business associate should have a privacy officer, but of course it's also required by the federal regulations, just like it is for the covered entity. So what about specialized training for the privacy officer? So the privacy officer really needs to have more training than the members of the workforce, but HIPAA does not require that you have a specialized degree. Um, the privacy officer does not have to be the office manager. It can be any other member of the management team, but just let me caution you. So a lot of times I see that organizations have made one of the providers the privacy officer, but the provider really doesn't have much knowledge of the rules of HIPAA, and they're really don't have an awareness program going on. So it's always not the best idea. You might want to have him as part of the team for the privacy, but it needs to be someone that's going to take on the role and make sure that they're monitoring and doing the things that they need to do. Remember that everyone that comes into contact within your organization with protected health information, they all have to have training on HIPAA. And this needs to be done on an annual basis. But members of the workforce can have training on the basics of HIPAA, whereas the privacy officer, you'll need more information and you'll need to dig in and have a better understanding of HIPAA and the laws. Oh, lost my place. I wanted to point out a couple of websites that I really like to use. The first one is hhs.gov. That's a great resource for you. You can type in the search, any questions that you have, lots of documentation that you can print off, lots of forms that you can print off there. So make sure that you write that one down, hhs.gov. The other one is sign up for emails for the OCR listserv. That is the Office of Civil Rights, and they are the ones that will be auditing you. They are the organization where you will report a breach. That is the organization that your patients go to when they want to complain. You'll get a lot of information from them. They sent out a lot of emails about the COVID and ways that you're going to handle that. So make sure that you can just Google OCR listserv. So write that down and make sure you sign up for them. Sorry. So let's talk about the roles and responsibility of the privacy officer. So you're going to be the key leader, you're the go-to person, you're accountable for ensuring that the HIPAA privacy is ingrained in the organization. You're responsible for ensuring that the requirements of HIPAA are being met. Anything HIPAA requires from a privacy or security aspect, if you take a step back, the core objective of HIPAA is to ensure that protected health information is protected through a set of privacy policies and procedures and technical safeguards. So as the privacy officer, you're overseeing the entire effort to ensure that privacy security of PHI. It's the development and the implementation of the policies and procedures to safeguard the privacy of the security of the PHI and maintaining those policies and ensuring that they're up to date. You know, your infrastructure changes over time, so you can't just buy a set of policies, put them on the shelf and think that they're going to work. You know, you're going to have changes. Maybe you implement a new alarm system. Maybe you decide to give building keys out to all the employees. So policies need to be updated to reflect any changes that you make. So if you have any change in your IT structure, remember policies need to be updated, and then you need to train your employees on those updated policies. And you're responsible for training your workforce on a yearly basis, at least annually. And they like you to do periodic reminders also, posters and emails, things like that. But your role is to contribute towards HIPAA. So if there's a breach or if there's an audit request from the government, the privacy officer is really the key person that gets contacted and connected. They oversee the entire effort required for assessing, maintaining, and monitoring the HIPAA privacy and security status for the organization. So again, your privacy officer contact information needs to be listed on your notice of privacy practices that's given out to the patients. So, so the privacy officer is critical in the event of an audit or breach investigation. You'll be the first person that the government will contact. So if you lack a privacy officer and that hasn't been assigned, you've already failed the audit, because that's the first thing that it tells you to do, that you have to have a privacy officer. You know, the Office of Civil Rights, they will randomly select, and it's about 5% of practices, to do a random HIPAA audit. You know, they essentially write a formal letter addressing the privacy officer and saying that we would like to audit, and here's the criteria that we're looking into. And it's very well laid out, but the bottom line is, you know, if you're being audited for attestation or a breach, the privacy officer is really the first point of contact. You have a set of responsibilities that we're going over today, and actions and procedures that you need to follow to respond. Or if you're going to inform the government in case of a breach happens within the organization. You know, the breach could happen because of PHI information, which is critical asset that HIPAA is trying to protect, has been compromised. The information could be compromised either because of internal misuse or mishandling, or because a cyber attacker broke into your organization's server or workstations and stole information. It could be a complaint from a patient. But in any of these scenarios, the privacy officer is the key role responsible for driving the effort. And, you know, so make sure your staff knows who the privacy officer is. You don't want OCR to call to schedule an audit and the person answering the phone doesn't even know what the privacy officer, who it is or what it is. So make sure that you're going over that in all of your meetings with your staff. So we talked about the security risk assessment. That's one of your responsibilities. The privacy officer is important in the assessment because you're the one that's going to have the answers about the policies and the procedures that you have in place, and you're the project manager for the process and the responsibility to complete the risk assessment. When you actually complete your risk assessment, what you're doing is you're uncovering the risk of compromised data. When you're trying to assess the risk, you know, in an organization to deal with attackers or see if your organization is at high risk, that means it's easy for anybody to come in and steal your information. The risk assessment allows you to understand the overall gaps that exist from a privacy compliance. And so you want to uncover those gaps so that you can make sure that you're protected. So when you're actually completing the risk assessment, it's asking you questions. So every single question, and there are many of them, the questions will always be, do you have a policy and a procedure for the following? And that's why when you're starting your policies, you want to start out with policies that are geared towards HIPAA. These are not your policies for your employee handbook. These are a total different set of policies and procedures, and it'll guide you so that you know exactly what you're supposed to be doing within your office. It's an excellent way to train yourself on being the privacy officer and knowing what you need to do. It's a big task, and most people will have outside help come in to do the risk assessment, but the risk assessment needs to be done annually, because the first time you do it, you're going to see there's a lot of things that you were not doing, and that's okay, but at least you're aware of it and you're working on it. So they're not asking you to do everything overnight, but you need to be aware of what you're supposed to be doing and be working on that. So documentation of the privacy officer. So you must have a thorough knowledge of your policies and procedures. And, you know, half of all of HIPAA requirements are administrative. You're vital to implementing these procedures. If you don't have updated policies and procedures, you cannot be HIPAA compliant. There's some technological aspects to it, but really a lot of what you're doing is mostly HIPAA is documenting proper policies and procedures. And that, again, that's another example where you're really a project manager. So the risk assessment is going to show you which policies and procedures that you need to have in place. And another thing to keep in mind, you don't want to just get those policies and put them on a shelf someplace. They have to be updated on a regular basis, and you actually have to follow them. You can't just say, okay, this looked good and this is what HIPAA told me I have to have. You modify those to make them fit your practice, but then you have to follow them also. There's been cases where organizations have gotten into trouble because they got a great set of policies and procedures, but they absolutely did nothing with them and didn't follow them. So how about managing the relationships between the covered entity and the business associate? And again, the business associate is anybody that's working with you that has access or potential access to your protected health information. So each business associate needs to have a privacy officer just like you do. The person can help you get a business associate agreement in place. So you call, you ask, let me speak to the privacy officer, and they will get that information for you. But you know, um, you want to have that agreement because that agreement is telling you that they're going to follow the law just like you have followed the law. Um, to be compliant, you must have a privacy officer assigned, sometimes referred to as a compliance officer or a security officer. And the burden to collect these agreements, that's on the covered entity. So you might be working with a new company and they don't offer to give you the business associate agreement, but that is, if that comes down to something with a breach or something like that, they're not going to say, you can't go back and say, well, they didn't give me one, because HIPAA has put the burden of collecting those onto the covered entities themselves. And you want to keep those agreements in a file. There's mentioned with HIPAA now that if you are audited or they're doing an attestation audit, they'll ask you for a list of your business associates that you have agreements with. So kind of keep all those together, you know, be prepared to have to make, a listing of those if you have an audit come up. But just remember that that agreement is for your benefit. That's making that business associate do the same things that you have to do, and protects you in the case of a breach. And so training, I know we talk about this all the time, and I know it's a burden for everybody. Everybody's really busy, but it is required, and it is required that you complete training on an annual basis. Um, if you make significant changes within your environment, additional training is also required. So everybody that comes into contact with protected health information or who has access to it, the privacy officer, that is your responsibility to make sure that the individuals have training. So I really feel that training should be done all at the same time every single year, instead of doing a few here and a few there. Some will do it like that, but I think that you should just have a program, and that program's going to run for a 2-week period, and you give people an opportunity to do it. They can do it at home, so you don't have to shut the office down. A lot of people don't like to do that. But if you have a new employee that comes in, so get them to complete their training during the orientation period, and then again, just put them in with the annual training. So it's your responsibility to train the employees and to keep records of the training, because you're going to be asked for those records from OCR. They want to make sure that you have records of what date they were trained and what they were trained on. And we live in a digital age now with cloud-based technology. So there are real economical resources that you can use to train your employees. And the resources will record the employees' activities for training and send reports to you for your records. You don't That doesn't have to be something that's so hard that you can't do, and it's very economical. Um, you know, Sometimes the providers don't want to do that, but it is your responsibility. You're the privacy officer, so you need to explain that I'm the one that's going to be in trouble if I don't get it done. So, you're there as the privacy officer. They want you to have that role. So part of your role is to train those employees. So you need to do that and document that on an annual basis. And make sure that the staff understand that they have to do this too, that they understand what the policies and procedures are. So, maybe during a staff meeting, you can pull out some of the policies and review them. Um, Again, just don't put them on a shelf. You should have them available so that your staff actually can see them. And you're always going to have that one person that said, well, I didn't know that. Well, yes, here it is, because if it's not written down, it didn't happen. We all know that. So let's make sure that they know where the policies are, they know what they are, and review them with them. It's your best defense against a breach. The truth of the matter is, although the government does not audit organizations a lot, there are a lot more breach investigations than there are audit organizations. And, that could come from a patient complaining, and they're going to come in and do an audit or an investigation. So the best defense against getting into trouble is letting your employees know and train them about what they can do and what they cannot do as far as HIPAA goes. HIPAA says you want to create a culture of privacy, and that's something that we've been talking about here. You want people to have this as part of their daily work routine. And so what can you do to improve compliance? Well, HIPAA says that you have to implement an awareness program, which is also required by the security rule. So think of things that you can do to keep it, in the top of everybody's mind. When somebody's, talking about patients in the lunchroom, remind them, put some posters where they can see them. Maybe you do a learning lunch. Have everybody bring their lunch in or order lunch for them, and go over some of the policies. Always make them aware that we have to be careful what we do with this. It's very, very important, and it, just keeps becoming more important in our world as it is now. Um, Involve your employees. Maybe ask them to come up with some ideas on how they can contribute towards HIPAA privacy. Give a reward. It doesn't have to be big, for ideas. Have lunch, put up some posters about privacy, make the policy manual accessible to the employees. Keeping patients' information safe is a joint responsibility. It's a whole team. So invite the employees to work together towards the common goal of creating a team effort. It really goes a long way, because at the end of the day, a single person cannot, make everything happen. And creating a culture of awareness and education helps the privacy officer to implement and monitor the HIPAA privacy status for the company. The staff like to get involved. You'll always have somebody that wants to be the cheerleader with you, and take advantage of that. So the privacy officer really is the HIPAA champion that we've talked about. Not everyone is excited about HIPAA compliance as you are or I am, but the privacy officer serves as the cheerleader and the taskmaster. So remind the staff of the importance of compliance. And so let's just recap to go over everything that we just talked about, but these are the things that you are responsible for. So you are responsible for the task of your yearly security risk assessment. You are responsible for updated and personalized policies and procedures. You are responsible to get business associate agreements with anybody that you work with. You are responsible for incident response team for incident reporting. You are responsible to train your workforce annually. You are responsible to create a security awareness program. and you're responsible to contact the person for complaints. Um, Make sure that you are the contact person that is in your privacy notice. And for access authorization management, let me just touch on that one more time. So when new employees come in, you get a new login and password for them. Well, a lot of times people will get busy and forget to take the login and password to ask, or if with your EHR, if you have to ask for somebody or your IT department, you need to take the logins and passwords away. You need to make sure that they don't have access after they leave. A lot of times that's what a lot of the breaches are about, because someone gets let go and they still have access, and they get in and they look up things and they steal information. So that's so important. So they have made that is one of the responsibilities of the privacy officer, is to make sure. So I would go back and look through your listing to make sure that there are no people that are still have logins and passwords, and they are no longer there. So I want to thank you for your attention, and for being here with us today. I just also wanted to go over a few of the things. I have a listing up here of some of the services that we offer. My information is down at the bottom, with my direct phone number and my email address. I also wanted to let you know I have a document for the responsibilities of the privacy officer. If you're lacking that document, please reach out to me and I'd be happy to get that to you and kind of go over it with you, um, just to help. Um, and if you are looking for any information for training, we also do secure email. We do risk intelligence scanning. That's a great way to find unencrypted PHI on your individual workstations or your server. We do backup with ransomware protection. There's many different services that we offer. We're all happy to help, or happy to talk with you about them. But if you have any questions, I'm happy to answer those. I haven't been looking, so let me just look really quick to see if we have anything. Okay. All right. I don't see any questions, but I appreciate you coming, and please reach out anytime. So I'm going to end the session now. Thanks a lot.